In this video, I'm going to show you how you can teach your dog to be comfortable being medicated with ear medication. In this video, you see me using two slightly different techniques with two different dogs. The first dog is Kobe. He's a young German Shepherd puppy in my puppy class. Today, his owner told me that she was having problems getting his ear medication into his ears, which the vet has prescribed. So here she's showing me how she normally gives his ear medication to him, or at least tries.
So I can't hold him, and then it ends up that I just sort of have to hold him like this and try and do it.
Put it in yet. Kobe's owner has tried using treats. However, we can use the treats slightly differently because the way they're being used here, Kobe's learnt that if he eats the treats and then the medication happens, which doesn't feel very comfortable, so he's now avoiding having the medication put in and backing away from the treats. We work with Louis here to show you what you can try differently.
Have the drops there, the treats, and then they start going like this, because what you're doing there is almost trying to fool the dog, and dogs aren't stupid. And often what a lot of dogs will do is go, oh, actually I'm not on the treat because every time I go to take the treat you're going to move that thing in. Does that make sense? So is I move the eardrops, then you get a treat. I move the eardrops, and then you get a treat. But I move the eardrops back over here so I'm not going like this in your face. Move the eardrops, then you get a treat. So that is different to going like this. Yeah? Okay, so we say, this is why food manners are so important, because you can just keep your treats on the floor.
What I mean by food manners is just teaching the puppy what you want them to do around food and toys. We do this starting from the first week of class. Anything that we're going to use as reinforcers, rewards, we get the puppy used to being calm around. We teach the puppy that if they don't just sit there focusing on getting their head in the treat bag or trying to mug us from treats, that the treats will come to them. So you can see that both the puppies in the clips are quite calm around food, even though it's on the floor in front of them. We call this food manners, but it's actually the owner who has to be more disciplined in how they use and handle and deliver the treats and the toys as rewards, because if the owner's not disciplined in how they handle these things, then the dog's not going to learn what we want them to learn. So we can't really blame the dog, it's more about how the owner handles these things.
Eardrops, treat. Eardrops, treat. And when my dog is happy with this, I see them, they're not flinching, I just take it a centimetre closer and then I give them a treat until I can take it all the way over here, and then I start stroking over here and then over here and then over here and then moving it closer. Does that make sense? So we always do show the dog respect in terms of, I'm not going to try and fool you because you're not stupid. Do you want to have a go? Finish.
So back to Kobe.
So again, I have my treats, but we need food manners. You can just drop the lead. Now it might be easier if he's lying down for this one. So we're just going to get him to lie down first because it just keeps him.
Usually when we're handling sort of smaller dogs, or we're handling around the ears, then I try and get the dog to lie down so that the dog's staying still, but also it's really easy to read if the dog doesn't want to be there because they're not going to be lying down anymore.
If you just put the lid back on that.
Now I know Kobe already has an association with the eardrops. It's a negative one, or one that I need to change. So I start off just with giving him lots of treats and reinforcing him for staying there, and I ask the owners to close the bottle of eardrops so they don't go everywhere, and I just teach Kobe that even if I'm holding eardrops in my hand, nothing bad happens, I'm quite predictable, and good things happen if he stays in that place. So as you can see, although I'm using treats, we're using them slightly differently. We're not bribing him with him. We let him investigate the bottle first and say there's nothing to hide, you can have a look, you can smell it, you can do whatever you like, and then we give him a treat to associate the sight of the bottle with something pleasant. After that, we keep taking the bottle towards him, but we try and keep it at a distance, which is comfortable. Now you can see I made a mistake there. He stood up. Now this is telling me that he's uncomfortable with the eardrops going that close. So I've pushed him too much. I need to slow down. You can also see where I place the treats. I always deliver the treats in between his front feet, on the floor in the same place. Now the reason I do this is so that I can keep his head focused, sort of forward and in one place, and he's not turning around because a tree doesn't know where the treats are going to come from. They're always predictable when they come from one place, and so he's likely to keep his face facing that way. Again, you can see he takes a step back, which suggests to me that he doesn't want to be as close as he was a second ago, because I might be pushing him too much. I need to just slow down and back up a little bit.
Good. And if he backs away, then what I'll do is I'll encourage him to come closer and lie down, because obviously if he's all the way back, I don't want to be leaning forward into him, I want him to come towards me. Good. 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 Do you see he backed away there? So that just gives me some more information, telling me I just need to keep my thing closer this way.
Probably giving him a real phobia.
You can actually, my German Shepherd used to go and hide when he saw the can of eardrops because he had an ear infection once and had to treat him. Good.
You can see this is about gradual exposure. We take the bottle towards his ear, but we're keeping it at a distance, and then we're taking it closer, centimetre by centimetre, and just making sure he seems comfortable at each step. And the treats just help associate this in a positive manner.
You just throw that bottle over. So there, it's a bit too much. You need to see what's going on. Slow down. So that's fine. You can have a look. There's no rush. I'm not hiding anything. Just going to check the side of his mouth. Keep my treat. And look how I'm holding the eardrops. Just because that's how they're going to go into his ear.
Yeah.
I can squeeze them. I can go in. Good. You see that he didn't flinch a second. You're going to need some more of your treats when you get out. And when I work, like I said, this is why week 1 we did food manners, because I want to be able to keep food on the floor quite easily, and I don't want the dog mugging. If they do mug, they won't get it. Good. You're going to lie down. Good. Good.
If the dog says, hold on a sec, I just need to see what's going on, that's fine. Let them have a look. Remember, you're not trying to fool them.
So this time I'm going to stick just after his muzzle, between underneath his eye, and stroke him there, and the treat. Is that one particular ear you're doing, or both?
Oh.
Now, see, he moved his head away there?
Yeah.
I was going too close. I'm going to stick just underneath his jaw, underneath his ear, and between his jaw is the point that I'm working on at the moment.
Because I think that's the one that saw the walls. Hopefully we'll clean it up. And it's much more pleasant.
Exactly. And when he has another, if he has another infection, hopefully he doesn't. But
Now this is so important for puppies, especially for a puppy like Kobe who's under 5 months of age and has already had some ear treatment, which he hasn't enjoyed very much. So he's now going to learn that actually these things are quite pleasant, they're not that bad, and so if he has to have any more ear treatment for the rest of his life, so we're talking over the next 15 plus years, hopefully he's able to do this without freaking out or having to be sedated. There are dogs who have to be sedated to have the ears checked just because of previous negative experiences with having ear medication put in an ear which is already very sore.
well done. Do you see there, Louis just backs away? So it's just telling us you're a little bit too much at the moment. What I would do, just watch over here for a second with Kobe. If you want to play, you have to lie down. Good. So with Cody, what I'm doing is I was starting off just where his chin is. And early on, I started off just like this. I had it in my hand and I was rubbing underneath his muzzle because there he's not backing away at all. Whereas if I go towards his ear, what I'm getting is a little back away, and I don't want that back away at all. So what I'm doing is I'm starting with just near his mouth and stroke there. And look, he's actually bringing his head closer for the treat. So I'm going to stop there. I'm going to stop there and get you to practice a bit more.
Okay.
Maybe give him a break for a second,
Okay.
and then we'll come back and we'll work towards interviews. Excellent.
Now, before we move on and have a look at another dog, my own dog Cody, having some similar training, what we're going to just make a point of is that just because you practice this with your puppy when they're 12 weeks of age or in puppy class doesn't mean it's going to help you for the rest of their life. It definitely sets you up in the right sort of pathway and helps quite a lot. But you need to make sure this is ongoing work. So every couple of weeks, just get something out and practice with your dog. Your dog doesn't need to have anything wrong with their ears before you actually do any of this work. So make sure that at least a couple of times a month you're practicing this. Now this is my Cody monkeys, and I noticed the other day that he has some dirty ears. He doesn't need any particular treatment, but before I start putting some ear cleaner in and generally cleaning, I just want to teach him to enjoy having this done, and I use a slightly different technique.
Touch. X. Touch. Good.
So with Cody monkeys, I use a targeting behaviour. He holds his nose against my hand, and I sort of use this to work on introducing the ear cleaner bottle to him.
Touch. Touch. Good.
So what I'm going to aim for here is I want him to hold his nose against my hand while I'm able to put the ear medication into his ear, and because he's focusing on putting his nose on my hand and holding it there, he's staying still and I'm able to do this. To start with, what I do is I hold the bottle out and then I ask him to touch, and he's up to him if he wants to sniff the bottle first, get used to it, make sure it's not scary, do whatever he wants, and then he can touch my hand and he gets a treat. Again, remember, I'm not trying to fool my dog, I'm not trying to hide anything from them. I want it to be a good relationship, I want us to both be participating in this activity, so I let him investigate and take his time. Notice in the next few clips his ear flinches slightly, and I want to show you this because if you're working and this is happening, it's basically telling you that you're doing it too fast, you're pushing the dog too much. He still maintains his hand target and keeps touching his nose to my hand, but he's not comfortable, you can see by his ear. So I back up a step and you can see I hold the ear bottle further away and I move it slightly, and if he keeps his nose to my hand then I tell him he's good and he gets a treat. Now remember, this is the edited training session, so you see me taking some big steps. Just from holding the ear bottle up where it was originally to moving onto my lap could take you 10-15 minutes, maybe it could take you a day or two. So don't rush this thinking that just because I'm doing it in minutes, you have to do it in minutes. You need to work at the pace that your dog is happy at, and that could be days, it could be weeks, it could be minutes. When you think about moving the bottle, think about moving it centimetre by centimetre.
Good boy. Touch. Good.
parrot in the background. Also notice that I am pushing him a little bit too much here because you see his ear flinch.
Good. Good. Touch. Touch. Good. 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 Touch. Touch.
So as you can see, I pushed him a little bit too much there. Now, at any time, if the dog wants to move away, they can. They don't have to keep their head on the target. It's optional. There's no force. And if he's uncomfortable, he moves his head away. I back up a little bit and we carry on. And you can see I'm now squeezing the bottle.
Touch. Good. Touch. Good. Touch.
So the parrots help with some more commentary, and you can see you can use the hand targeting for other behaviours as well.